I'm Dr. Jen with White Wave Bodywork, and in this video what we're going to talk about is some core strengthening, hip flexor strengthening, and what I would call a tabletop position. So go ahead and lie down on your back. We're going to take the knees straight up from the hips and try to get the feet to come so that the shins are parallel to the ceiling or to the floor. From here, I'm going to move my arms out of the way so you can kind of see what I'm doing with my pelvis. In this position, when we're lowering the legs, it makes the pelvis want to dip forward and create a dip in the low back. When we're raising the legs, it makes the back want to flatten out. So what I want you to try to do while we're doing this exercise of pulling the knees back and forth is keep the pelvis still. So let's set up the pelvis in the position we want to keep it as we're lifting the legs, okay? So in order to do that, we're going to tip the pelvis in an anterior position to create a dip in the lower back. Now when I say that, people do exactly what I'm doing here. They also lift the rib cage to get what I want here. I want you to try to tack the rib cage back so that the back ribs feel like they're on the floor, but still maintain a dip in your lower back. Now, sometimes when I say that, they're doing too much dip in their lower back. So if you come all the way forward and then pull back, what I say is about 20%, then you're usually in a nice robin's egg shape kind of position where you can just like kind of slide your fingers underneath your lower back and there's a little lift. You just don't want the lower back pressing flat against the floor or escaping way far either direction. I want it to be a neutral position for the spine. Now having said that, some people have pain when I'm guiding them into spinal neutral. So if this is something that's painful for you, don't do this exercise. Refer to a professional, okay? There are scenarios where you would want one or the other, but a neutral spine is what we're aiming for here for a nice, starting with a healthy back individual, okay? We're just trying to strengthen the core and the hip flexors from a neutral place in this pelvis. So we've got a little dip in the lower back, and I'm going to keep my hand here so I can feel if that moves, if it flattens out or if it arches a lot. I just want to try to keep it still. And I also want to try to keep my rib cage tacked back because that activates my upper abdominals as well. So from here I'm going to take one leg up at a time, and I'm going to flex my feet to keep all the muscles in my shins active, and we're just going to try to escape a little bit and pull back a little bit. Now if I pull back a lot, it's obviously going to flatten out my back. So I want to try to keep this little lift, keep my abdominal muscles here activated by pulling my rib cage back, and just come to the knees above the hips if I can do it, and then a little bit out. The stronger you are, the further you can go without letting your pelvis dip or your rib cage splay. So just do what you can. Try to come from this straight up perpendicular position of your femur, of your thighs, and just hinge from the hips. So this angle is what I want to be moving right here, the hip angle, not the knees. The knees and the feet, lifting and lowering, isn't doing much here. The knees stretching out and trying to keep the shins parallel to the ceiling is really what the exercise is all about, without moving anything here. That's the trick. So we're hinging and pulling in without moving the lower back. Now the other thing I want you to do is place a hand on your belly. Okay, so as you're hinging, can you coordinate it with your breath and just place this hand, don't push down, just place this hand and see what happens with your belly during this activity. If you feel a little peak happening there, like a little pooch happening there as you're going out, this exercise may be too hard for you. And I want you to back it down if you can't avoid that peak with your breath. So let's talk about breathing. I don't care whether you breathe in or out in which direction. I just care that on an exhale you pull the belly button in and you never throughout this exercise feel this peak happening here, okay? So I'm going to try to inhale on my way out, exhale on my way up, and pull the belly button in as I exhale. Inhale, fill up, exhale, pull in the belly button. pull up on the pelvic floor. That exhaling and pulling in and contracting is what's really important to me. And as long as I feel like I don't feel a pooching out happening here, then I'm at the right level for me. And that is individually specific. That's not something that I can tell you, 6 months postpartum, you should be able to do this, or how old you are, you should be able to do anything. It's person specific, from person to person. So feel what I would be feeling as your PT if any of those funky things are happening. If you're having that pooching feeling, you may have a diastasis, and I have a video on self-check for diastasis. If you're not able to maintain the position of your pelvis, I have a video where we're doing heel tapping marching with just one foot. So you're working up to that. There's ways to get to this place where this is the level you should be at. But if you're feeling those modifications happen and you can't avoid them with those cues, maybe back it down a bit and go back to some of those other videos and try those first. All right, try it out. Let me know what you thought about the cues that I gave, and leave me some comments in the comment section below. Thanks for watching. I hope you learned something helpful.